Welcome to the Borg-Warner Ithaca Union Open Enrollment presentation. Open Enrollment 2025 begins November 1st and ends at midnight on November 15th. Benefit elections and changes will go into effect on January 1st, 2025. If you have questions about your benefits or your enrollment, please contact HR Link by either calling the HR Link hotline or emailing. We work typical business hours and we will do our best to respond within 24 hours. As a reminder, benefits can only be changed when you're newly hired, during our annual open enrollment period, and if you experience any qualifying life events. Elections made during the enrollment window will be effective for the entire year of 2025 and cannot be changed until next open enrollment, or if you experience a qualifying life event. Please review in depth the benefit information on the Borg-Warner Ithaca Benefits website. Now let's talk about the new Benefits Hub. We are transitioning our benefit administration system from Workday to our new Benefits Hub with Business Solver. To make selecting your benefits easier, the new Borg-Warner Benefits Hub will be available year-round to review your plan information and resources, access tools to improve your health, check your enrollment status, and make qualifying status changes, and more. With the new platform, you will have the ability to roll in your benefits on any device by downloading the Business Solver My Choice Benefits app. The new Benefits Hub offers a decision support tool. If you're unsure of which plan is right for you, during open enrollment, you will be given the option to answer a few simple questions to find the plan that is best suited for your needs. The tool will analyze your results and present you with a plan that recommendations specific to you. You can either accept the benefit plan shown or choose your own. Have questions about your benefit coverage and don't want to wait on the phone? Ask Sophia. Sophia is your personal benefits assistant, available 24/7 within the Benefits Hub. If Sophia isn't able to answer your questions, we'll direct you to HR Link. Now let's get started. The new platform has two easy ways to enroll in your benefits. One, by logging into Workday and clicking on the Benefits badge. It will direct you straight into your enrollment. Or you can register your account at borgwarnerbenefits.com. You'll answer a few questions and create your username and password. Please note that you will have to provide an email address to complete the enrollment. When you first visit the Benefits Hub, you will need to update your contact information to receive important notifications about your benefits and your enrollment. If you prefer not to receive emails, you can always sign up to receive text messages. When enrolling in the platform, you'll have two options. You can start by clicking on the Decision Support tool, or if you know which benefits that you would like, you can click on I know what I want. When enrolling in medical, regardless of how many points you earned, your contributions will show on the first page without your premium points credit. At the end of the medical enrollment, on the medical election summary page, the well-being points credit will show and will be deducted from your cost. When enrolling, the hub will walk you through each benefit available. You will select the benefit you want to be enrolled in or waive the coverage. At any time during the enrollment process, you can click on the plan details or compare plans tools to get more information. Once done, you'll want to review all your information and click I approve. You will then receive a summary and a confirmation. The Hub will require you to select a beneficiary this year. This means you will need to select at least one person or trust for your life and AD&D coverage. The site also gives you the opportunity to enroll a contingent beneficiary as well as a primary. If you're adding a dependent for the first time, you will need to submit supporting documentation. This could be a copy of a marriage license or a child's birth certificate. If you're having any issues uploading or questions about the documents that you can supply, feel free to call our Borg-Warner Billing and Verification Center. Now let's talk about the plan changes. For 2025, we are eliminating the spousal surcharge and the working spouse role. What this means for you is spouses will no longer have to complete 2 voluntary actions for you to avoid the surcharge. Also, spouses can now be on our plan as primary coverage regardless on whether your spouse has coverage through their employer or not. For 2025, many of your Borg-Warner paid benefits have increased. The first is life insurance. Employees' basic life insurance has now increased from 1 times to 2 times your base salary. Please note, according to IRS rules, imputed income will be assessed on your paycheck and the appropriate taxes will be deducted. You may choose to cap your benefit at $50,000 to avoid any imputed income tax. If you're interested in capping, you will have an option during your enrollment. We also have increased your AD&D coverage. You will now be provided 1 times your base earnings. Also, short-term disability has increased from the weekly amount of $225 to $300 a week. Now let's discuss our medical plans. There are no medical plan changes for 2025. Individual deductibles of $1,500 and a family deductible of $3,000. Borg-Warner's funded HRA amounts will remain the same as well. Any preventative coverage is at 100% and non-preventative is at 20% coinsurance after the deductible is met. As a reminder, you have to earn at least 5 points by September 30th's deadline to receive the lowest premium deductions from your paycheck in 2026. The program has not changed for 2025. We will still be offering the 7 options as seen on the chart above. Only 5 out of the 7 options are needed by September 30th of 2025 for the lowest premiums of 2026. Now, please take some time to review the medical premiums for 2025. Cigna is going digital. They will no longer be automatically sending out new ID cards. You can access digital ID cards easily on the mycigna.com or on myCigna's app. You can request a physical card by going onto your myCigna account and requesting ID cards. Now let's discuss dental and vision. For 2025, dental and vision will be split into 2 separate benefit plan deductions. You now can select dental and vision separately, and for 2025, the dental coverage has no changes, while vision has increased its claim allowance to $130 every 12 months. Now let's talk about voluntary benefits. Hospital indemnity coverage pays cash benefits or mins to the hospital as an inpatient during which covered services are received. These benefits include accidents and sicknesses, substance and mental health, as well as maternity coverage. Employees have the option to select basic or enhanced coverage. Accident insurance provides additional coverage for when an employee or a family member is injured either on the job or off or through organized sports. Employees have two different options, the basic and the enhanced coverage. Plan highlights include things like fractures, emergency care, concussions, burns, and many more. MetLaw's legal plan can assist with many different legal needs. The plans cover things like money matters, estate planning, civil lawsuits, issues regarding family and personal life, home and estate, and traffic and other offenses. There are two different options available, the basic plan that covers you and your immediate family, as well as the enhanced plan that covers not only you and your family, but will cover up to 8 parents, grandparents, or parent-in-laws. New this year is Allstate's identity theft protection, which includes monitoring immediate and proactive alerts and full service restoration. Employees can enroll in employee-only or family coverage. Starting January 1st, all beneficiaries for life and AD&D coverage will be stored directly within the Benefits Hub. This means during open enrollment, you will be required to put at least one beneficiary within the system. You are eligible to put multiple beneficiaries as well as contingents in the system as well. After December 31st, no beneficiary information will be stored with MetLife. Now let's discuss Empower. Effective October 1st, our record keeper for our 401k has changed from Vanguard to Empower. You should have received materials at home regarding the transition. The website now has enhanced features, greater planning tools, and offers us extended hours to speak with phone representatives. If you haven't already, try managing your account online through the mobile app or right through their toll-free number. Take action soon. Now let's go over the items that you will need to enroll. Be ready with an email address when you start your enrollment. You will also need to have your beneficiary information available, and if you're adding a dependent for the first time, be sure to submit all of your documents by November 30th. If you're changing your life or AD&D insurance, you may be required to complete an evidence of insurability notice. Be sure to review all the necessary documents and actions at the end of your enrollment. Now let's go over a couple last-minute reminders. You must go into the system by November 15th to complete your enrollment. No benefits will roll over. Also, please be careful when you're selecting your benefits to ensure that all of the benefits that you want to enroll in are selected and you have the appropriate dependents on those benefits before signing off. If you do have any questions, feel free to reach out to HR Link. Now, if you do need any information regarding any of our benefit information, you can always go to www.borgwarner.com/benefits and view all of your benefit information, as well as click on a link to get you directly to the BorgWarner Benefits Hub. Have a great day.